The impacts of the pandemic on our minority communities. Hi, my name is Zegaliara, and today I will be presenting this PowerPoint in order to establish and propose possible policy changes with regards to the interaction between this government and the ethnic minority groups across the country. Our minority communities have felt the brunt of the impacts of the pandemic and the ensuing policies. By the end of this presentation, I hope you will have a greater understanding on the origin of the problem, its nature, and the evidences which support the existence of this widespread issue in our society. The problem. In this section, I will briefly explain the problems caused by the pandemic. In the following slides, I will delve deeper into the roots and evidences. As previously mentioned, the pandemic has had a huge and unequal impact on minorities, with detrimental impacts in relation to social, economic, and mental factors. Throughout this PowerPoint, I will attempt to define and sort the relevant factors into these three categories. The first category to be mentioned relates to the mental impact on ethnic minorities. Lockdown measures introduced effectively obstructed the opportunity to perform religious and cultural ceremonies, leading to mental health issues due to the fact that funerals, weddings, and prayers were impeded. The importance of these ceremonies and the fact that they were impeded can lead to huge levels of stress on the part of the affected and can result in certain instances in these people becoming pariahs within their respective communities. The second category defined relates to the social impact of the pandemic. Firstly, expressing mental health problems can be seen as taboo within certain communities, which could again lead to the creation of pariahs and social exclusion. In addition to this, the focus of media on minorities in relation to the spread of COVID has led to increased tensions between communities and a rise of discrimination. This focus and misrepresentation by the media can clearly be seen in Figure 1, the disparate reporting between a mosque congregation and a funeral, despite 250 attending a prayer and the funeral attracting thousands. This displays clearly an attitude of prejudice exacerbated by the media. The final category defined is the economic impact felt by the ethnic minority groups across the country. The loss of jobs and death of primary earners may lead to long-lasting financial implications for minorities, with children growing up in poverty, continuing a cycle of deprivation, and increasing the chances of these generations falling into insecure employment, the initial cause of the issue. Genesis of the problem. This section will be utilized in order to establish the root of the problem and to further expand upon the issues previously mentioned, while once again dividing these issues into these three categories already defined. With regards to the mental issues as a result of the pandemic, there is an historical inequality in relation to health between minorities and the majority white communities. For example, the increased risk of South Asians developing cardiovascular disease and type 2 diabetes. This points to a wide range of social and economic factors which will be examined further in the following categories, whilst also displaying clearly the need to prioritize this issue, as both these diseases can potentially be fatal, as seen with the increased mortality rates of minorities when compared to white population. Furthermore, evidence obtained by infection surveys displayed increased chances of previous SARS infection compared to the white population. This once again points to social and economic factors, with the argument that this is due to genetic makeup being heavily criticized and mainly being adopted by groups who hope to alter this theory to support rhetorics of white supremacy. It is also vital to understand the economic situation of the majority of minority communities and the role this has played in the unequal impact of the pandemic. Firstly, and most importantly, there is a lack of access to resources that could affect the resistance to contraction as a result of structural inequality due to socio-economic factors. For example, those of ethnic minority background are twice as likely to travel to work using public transport. This is indicative of financial position and could lead to increased chances of infection. In addition to this, the nature of employment has been linked to increased mobility among ethnic minorities. This is due to the increased likelihood of minorities being employed in customer-facing roles, such as in the health industry and in retail. An example of the impact of the pandemic and the detrimental implications it can have can be seen with the fact that 29% of Bangladeshi men worked in a sector that was forced to close, as compared to the 1% of white men. This essentially cut these individuals off from their income stream, an experience which was shared by minorities across the country. The social dimension could possibly be inferred as being a product of the previous two categories, due to the fact that it determines the impact of the issue with regards to everyday interactions and perceptions. As previously mentioned, and displayed by the disparaging news articles in the previous slide, the underprotection of minorities by the media and the authorities has ultimately resulted in the stigmatization of minorities. Another key issue discussed was the messaging in relation to COVID regulations and safety has not been adapted successfully for the greater understanding of minorities in order to combat hesitancy to receive the vaccine. This hesitancy contributed to an overall skepticism towards and around the vaccine, reducing the numbers of individuals willing to take the jab and therefore increasing the duration of time taken for the country to overcome the pandemic and therefore emerge from it. Furthermore, living in overcrowded conditions results in contact with a higher number of bodies, possibly resulting in more chances to contract COVID. This can be linked to the economic situation of many minority communities due to the fact that the existing economic disparity is what leads to the necessity to live in overcrowded properties. As previously mentioned, minorities are more likely to work in frontline healthcare positions and therefore more likely to contract COVID, again pointing to the economic inequality as minorities do not have equal representation with regards to executive roles. Evidence of inequality. Having established the genesis of the problem and the factors which point to and explain the unequal impacts of the pandemic on minorities, the following slide will display clearly the facts and statistics which will prove the existence of this issue beyond any doubt, and highlight the importance and need for the introduction of targeted policies which will hope to alleviate this issue provided time and adequate implementation. The medical evidence must first be presented in order to provide a foundation from which the economic and social factors can be understood and acknowledged. For example, a study of 35,000 UK hospital admissions revealed that there is a 30% increased risk of critical care admission among minority groups. In addition to this, 35% of all patients during the first wave were from minority backgrounds. In addition to this, there is between a 10 to 50% high mortality rate in ethnic minorities, and the first 10 doctors to die from COVID were of ethnic minority origin. This points to and supports the conclusion that the pandemic had huge adverse implications for minorities, possibly compounding the existing inequalities and affecting the possibility of reducing this gap in the future, and once again supporting the need for policy change. Having presented the relevant statistics in relation to medical impacts, the evidence of economic impact can also be seen with the established lack of resources, which can lead to an unbalanced diet and which could lead to malnutrition, which again affects the immune system's response to COVID, leading to increased chances of contracting COVID. In addition to this, the majority of minorities are more likely to inhabit economically deprived areas, as seen with the fact that people of Pakistani origin are 3 times as likely to live in urban areas compared to the white population. Despite having exhibited evidence for the medical and economic factors, the factor which displays the inequality of impact most effectively is the social implication on minorities. This is due to the fact that it describes effects of which can be experienced and witnessed by all peoples, regardless of profession or position. Firstly, the lack of investigation on the effectiveness of messaging related to the pandemic points to the lack of understanding on the impacts and opinions of minorities. This gives indication to the wider problem of existing tensions between minorities and governmental organization due to a lack of trust and the aforementioned lack of understanding. Secondly, ethnic minorities are shown to live in more polluted areas. Studies show that air pollution is the worst in diverse areas. Pollution can have adverse effects on health, particularly on the lungs as a result of inhaling possibly toxic fumes. In addition to this, the issue of living standards and lack of understanding, the rising racial tension of the pandemic, and the discriminatory narrative peddled by the media led to an increase in hate crimes against those of Chinese descent due to the fact that the origin of the virus was in China. This can be seen in the fact that 260 hate crimes within the first 3 months of the year were targeted towards those of Chinese descent, with Figure 2 displaying clearly this increase coinciding with the start of the pandemic. A further notion which deserves elaboration is the interplay of these factors, namely the medical, economic, and social, due to the fact that despite the ability to categorize these factors into 3 groups, it remains true that it is the interplay and relationships between the medical, economic, and social spheres which cause the issues mentioned. Possible policy proposals. The problem of inequality between minority communities and the white population within the United Kingdom has in no way, shape or form been as a result of the pandemic, with tensions and criticisms towards governmental policy having existed decades prior. The pandemic, rather, has exacerbated and highlighted the inequality and therefore the need to tackle this issue. These 3 policy changes proposed aim to improve relations, demonstrate understanding, and act as the catalyst for the creation of a culture of progression and evolution into a more equal society in terms of opportunities and resources. The first policy change proposed is the reconsideration of messaging in relation to vital information on subjects such as possible furlough schemes and lockdown regulations and changes to these regulations. It is vital to ensure that communications such as this reach all communities in order to solve the problem of lack of understanding on the part of minority communities. Therefore, improving the chances of minorities signing up for available schemes, improving their chances of bettering their situation, and reducing the chances of bankruptcy and possible medical implications. The second proposal is the introduction of an independent regulatory panel. This panel will be comprised of members from ethnic minority backgrounds whose responsibility it is to review government progress in relation to tackling issues related to minority groups and to regulate government action in relation to these efforts or a lack thereof. The final proposal relates to the introduction of a policy of integration. This will be an incumbent responsibility upon the government to integrate itself within ethnic minority groups across the country, with a view of improving understanding and the possibility of sharing opinions on the progress of related issues. This can also help to improve the relationship between government and minority groups. The evidences and factors provided throughout this presentation clearly display the need for increased integration. The proposed solution. Ultimately, I believe the proposition of an independent regulatory panel to be the most important project of the 3 to establish within government. This independent regulatory panel can be implemented to improve relations between ethnic minorities and the government, due to the fact that it displays willingness to better the situation of ethnic groups within the UK. The lack of movement in regards to the improvement of relations has long been a point of tension for ethnic minority groups who feel the lack of progress is indicative of the attitude of the government towards them. In addition to this, this panel can improve the rate of progress by government. in relation to policy introduction and implementation by applying pressure on relevant areas of government, whilst it can also regulate government action or inaction towards ethnic minorities, effectively aiming to improve the interactions between the two parties. Ultimately, however, this panel will place emphasis on repairing attitudes of ethnic minorities due to actions of governments in the past, establishing a foundation which can springboard a new age of tolerance and consideration for new and existing generations. Thank you for listening to this presentation. I hope I have clearly demonstrated to you the unequal impact of the pandemic on minority communities across the country, taking into account the origins and evidences of the issue discussed. I anticipate your response to the proposed solution and hope you share my opinion that it can help to alleviate the problem. Thank you.